What do you say to the doctor that says, I trained for this for a long time, I got sick people, I can't go out and do something
Well,
else?
I think everybody has to make that kind of decision for themselves. Everybody's ethical feelings about those things are different. But what I would say is if you really want to help sick people, what about national health insurance? What about dealing with the 37 million people that are getting inadequate health care? Certainly that's a lot more people than an individual in their office could ever help in a lifetime of medical practice.
Do you have any idea about, or do you have any thoughts about how long it'll be before there is a national system?
I think it'll clearly be by the end of this decade.
That soon?
Absolutely. I used to say that and think maybe it'd be a little longer, but now I think if anything, it's too far out. I think the most likely time to do it would be between 1992 and 1996. Now, it'll have to be phased in unless we want to destroy our healthcare delivery system, which I don't think anybody does. But I think by the year 2000, everybody will be insured in this country.
Take me off the key elements of a good national health system.
4 of them. Universal access is the most important. I think everybody, wherever they are in the political spectrum, realizes it's not fair to ration health care by ability to pay. Second, cost containment. You can't talk about universal access in any kind of a serious way unless you talk about controlling costs. I think the states have got to administer the plan. It's probably not worth doing if the federal government does it, because I think it'll degenerate into a system that most Americans will not be satisfied with in terms of the way health care is delivered to them. There are too many procedures done in American medicine today, absolutely too many. 50% of Medicare dollars are spent on 9% of the patients in the ICU. Only half of those ever get out alive in that population. So we're talking about spending all the money for the high-ticket items. What about spending money for smoking education or alcohol abuse education or seat belts? What about spending money on prenatal care, which oftentimes is not covered in certain insurance policy? The American people are incredibly ambivalent about how they want to spend their money on resources. That is, you and I may sit here and agree that it doesn't make any sense for a 75-year-old lady who has terminal cancer to be left in the ICU for 2 weeks before she passes away. But if it's your mother or my mother, we might have some different feelings about that. And the fact is that that's where the American people are about this. And what I'm trying to sell is the idea that we can cut out some of these things that we do and not change our quality of life, in fact, perhaps improve it, but still not have the same kind of freedom to demand every service we want and expect somebody else to pay for it.
Well, I guess doctors would be some of the more logical people you would think that could help do some of these big plans, but a lot of doctors are frustrated. They think they're getting frozen out of the process.
There are. I mean, we had a bill in our legislature, the first bill that was introduced for comprehensive reform, said right in the bill, providers shall not be on this panel. Well, I mean, I can promise you that they need 2/3 of a vote to get that one enacted into law, because that's what it takes to override a veto. I mean, it's crazy for doctors not to be involved in this process. We've got to be there planning this system, or it is going to result in poor patient care and a horrible financial morass. Nobody understands the doctor-patient relationship any better than physicians, any better than people who take care of patients. The idea that people who actually take care of patients ought to have nothing to do with planning our healthcare delivery system is nuts. We've got to have doctors in there understanding that we don't want the government involved in the patient-physician relationship. It's not the care that people resent, it's the cost.
Interesting man in a unique situation. Bob, what if the state of Vermont, under his leadership, were able to set up such a splendid healthcare system that people from other states began flooding there to take advantage of it?
Sure, you could envision sick people going from state to state, maybe to Vermont, to take advantage of this. And if that happens, they're going to have to establish some state requirements for residency, maybe even some pre-existing conditions to limit it.
You know what I hear the good governor saying is that when it comes to healthcare matters, the political decisions that have to be made are too important to leave to the politicians. Doctors have to get involved. Right.